What is the safe exercise intensity for rheumatoid arthritis? Imagine moving your body in a way that boosts your health without risking flare-ups. That's the goal for people with rheumatoid arthritis. The key is finding the right balance of exercise intensity that supports your joints and overall well-being. Generally, moderate intensity exercise is considered safe and effective for managing rheumatoid arthritis. This level allows you to gain cardiovascular and muscle benefits while minimizing the risk of increasing joint inflammation or pain. For aerobic activities like walking, swimming, or cycling, aim for about 150 minutes each week. You can break this into shorter sessions if needed. A simple way to gauge if you're exercising at a moderate level is the talk test. You should be able to talk comfortably but not sing during activity. This usually corresponds to a perceived exertion rating of around 11 to 13 out of 20, meaning you're working but not overdoing it. Strength training is also important. Use light to moderate weights that you can lift 10 to 15 times without discomfort. Focus on exercises that target major muscle groups and avoid putting strain on inflamed or damaged joints. Performing strength exercises about 2 days a week is ideal. Isometric exercises, which involve muscle contractions without joint movement, are especially safe and effective at low intensities, about 10 to 20% of your maximum tension. Eccentric exercises, which involve muscle lengthening under load, can also be beneficial when done at moderate intensity. Starting at about 50 to 55% of your 1 repetition maximum and gradually increasing to around 65% can improve body composition and reduce cardiovascular risks. These exercises should be performed about 3 times weekly for around 40 minutes, with careful progression to avoid overexertion. Monitoring how you feel during and after exercise is crucial. Begin at a lower intensity, around 5 out of 10 on the exertion scale, and slowly increase to a moderate level of 6 or 7. During activity, you should be able to speak in short sentences without excessive breathlessness. If you notice joint pain that worsens more than 2 hours after exercising, it's a sign to cut back on intensity or duration next time. Every person's experience with rheumatoid arthritis is unique, so exercise programs should be personalized. If your joints are damaged or inflamed, low-impact activities like swimming or cycling are safer options than running or high-impact aerobics. For those with upper extremity joint issues, heavy lifting or vigorous arm exercises might need to be modified or avoided. Consistency is also important. Aim to be active most days of the week, ideally 3 to 5 days, with sessions lasting between 30 and 60 minutes. These can be split into shorter bouts if needed, making it easier to fit into your daily routine. If symptoms persist or worsen, it's wise to reduce exercise intensity or consult a healthcare professional or physical therapist to tailor your activity plan safely. Using recovery aids such as ice packs or foam rollers after eccentric exercises can help reduce soreness and inflammation. Remember, the goal is to stay active in a way that supports your joints and overall health without triggering flare-ups. When exercise is carefully managed and individualized, it can improve cardiovascular health, muscle strength, joint flexibility, and your overall quality of life. Always consult your healthcare provider before starting or changing your exercise routine to ensure it fits your specific needs and condition.